Hello, dear friends. I'm so thrilled to be with you today as we continue our series on diabetes in pregnancy. If you recall, we've done the first, second, and third trimester. We also took the pre-pregnancy state when talking about diabetes in pregnancy. Today, we are going to talk about labor and delivery for the diabetic patient who is pregnant. Now, what are the things you need to watch out for? First things first, this labor and delivery process must be planned. For patients with diabetes in pregnancy, it's not that kind of labor and delivery that should happen upon you suddenly. As a matter of fact, no labor and delivery should happen upon you suddenly. But for patients who are diabetic and they are pregnant, their labor and delivery must be planned. And what does that involve? You need to sit down with your caregiver, your obstetrician gynecologist, and the entire team of caregivers who have been with you from the beginning, the endocrinologist or the diabetologist, the dietitian, your obstetrician, the midwife, and based upon your parameters and your fasting blood sugar, your glycated hemoglobin, your sugar profile in general, they are going to put that as a consideration. They're going to consider the well-being of your baby also. As the baby be growing very well, is there any intrauterine growth restriction? Are there evidence of poor control like excessive amniotic fluid, what we call polyhydramnios? So they want to put all of those things in perspective. They want to run about physical profile for you to look at the well-being of the baby. You look at the tracing of the fetal heart and also other physical features of the baby in the womb, just to give a picture of how the baby is doing in the womb. And with that information, a decision will be made on the best route of delivery that you will use. Is it going to be a natural birth process, or is it going to be by C-section, an elective C-section? That is a C-section that you're going to plan. So all of those things will be taken into consideration. Or are they going to decide that the pregnancy has gone too long and they have to terminate the process of the pregnancy by inducing labor artificially? These are all factors that will be considered at this point in time. So you must be attending your antenatal care or your prenatal care frequently, and you must be talking with your caregivers, and decision must be made with you on the best route of delivery. After that decision has been made, the necessary support structure you need in the process of labor and delivery will be put in place. If it's going to be through natural birth, of course, you're going to go through labor. Labor will be monitored in a special way. All through the labor process, your fasting blood sugar will be monitored. This is part of the protocol. If it's going to be by C-section, it needs to be picked for you, and they will your caregivers will ensure that all the things you need for that C-section are in place. Your sugar control structure will be in place for the C-section, and throughout the process of the surgery and the post-surgical period, all of these processes will be in place to take care of you and ensure that you deliver safely. After you've delivered safely, it's still important to keep an eye on your sugar level, because that can go haywire even after delivery. For the first few days, there'll be need to monitor your sugar level. There'll be need to change therapy. There'll be need to put you on parenteral insulin during that process based upon the way your sugar is. All of these things is based upon so many factors. Your caregiver should know and should put the team in place to ensure that you get the needed care that is required for you. And after you've delivered safely and everything is going well, you will now plan your post-delivery period, which is the prepare room, all the things you need to do. We'll talk about that briefly in our next meeting. Till we meet again, bye and take care.